What happens to these people who have been told that their beta cells are destroyed? It's not actually the destruction of the beta cells. It is the damage to the beta cells, in the sense that the glucotoxicity doesn't allow these beta cells to function in a proper way. In a chronic uh, long-standing glucotoxicity, these cells, the beta cells, de-differentiate. That is not a one-way process. The differentiation from a primitive stem cell to an advanced cell like a beta cell is not a one-way direction, one-way reaction, or one-way path. It is reversible also. So even if you have a highly developed cell like a beta cell producing insulin, and you have an environment where you have high sugar levels, that glucotoxicity can produce what is called a de-differentiation. So these cells, the differentiated cells, de-differentiate into the primitive cells towards the stem cells, and they stay there. That is nowadays considered to be a safety mechanism. Probably the body wants to save these beta cells till the body overcomes the obesity and the peripheral insulin resistance. So once insulin resistance is over, obesity is less, then these cells again differentiate into the beta cells. So this is a common scenario where we find that people, once they have a very high blood sugar, for example, a HbA1c, classically, like they would say, if you have a HbA1c of more than 9% this onset, you should give insulin. And a lot of doctors do practice that. And now they say even you can give a combination of drugs. Personally, I would always go for a combination of drugs and try to reduce their blood sugar level. The moment you start reducing the blood sugar level, the requirement of the drug decreases. The same patients comes with lesser, with lower sugar levels, and then the requirement comes down. For example, if he was put on, say, insulin 20 units in morning and 20 units evening, after some time, on the same dose, he remains well controlled, say, for a month or so, and then he says that now I require less, I'm developing hypoglycemia. So that is the time you reduce the dose. It's a very common thing which we have seen, that after the initial very high blood sugar levels, once we start controlling them, they drastically come down, and then they are maintained on a lesser dose than what we had initially thought we'll put them on. And as they lose weight, the requirement also comes down. So that is the time when these beta cells uh, differentiate again. Uh, the stem cells, they differentiate again into the beta cells, and that's a stunned state uh, of beta cells. So they are in a damaged mode, and they are not dead. If they were dead, then they would not revive. For example, this was seen in the direct trial recently. Like I said, in the direct trial, once we reduced the weight, the diabetes reversed. So that means they had adequate amounts of beta cells to produce insulin and to take care of the sugar levels. Not only that, we had patients, morbidly obese patients, who got gastric banding and other bariatric surgeries, where after bariatric surgery, even 4 years after that, uh, more than 50% of the patients had remission of diabetes mellitus. That is an eye opener for us, that it is not all is not over. Uh, Things are not not come to a dead end. And like the direct trial, the message at the end of the article is that diabetes is a complication of obesity, and it is not true that it's not reversible. It is reversible indeed. It's not a permanent condition.